Welcome to the Putcast podcast by Pharmacists United for Truth and Transparency. Pharmacists United for Truth and Transparency is the only registered 501c3 nonprofit wholly dedicated to exposing the hard truths about pharmacy benefit managers and how their greed-centered, profit-at-any-cost business practices are driving up drug prices and healthcare premiums while reducing consumer choice and endangering patient access. To learn more, visit our website at truthrx.org.
Hi, everyone, and welcome to the newest episode of the Putcast, brought to you by Pharmacists United for Truth and Transparency. I'm Lauren Young. I am the board vice president of PUT, and I am wonderfully joined by our great executive director, Monique Whitney. Hi, Monique. Glad to have you back with me.
I am so happy to be back with you, and I'm really excited about our guest and our conversation, particularly because he's in my state, Arizona, and he is our secret weapon, and I couldn't be happier that we get to talk with him today.
Yes, I love getting to watch any Arizona Legislative Committee hearing, especially when I know Ken Patel is on the docket to be speaking in favor of PBM reform. I know that, Monique, we have talked about this whenever there is a committee hearing. And again, welcome, Ken, to the show. But we're so excited to get to share what you do and how you do it and get other owners to step out and speak up and do exactly what you're doing in other states. So welcome, Ken. We're so glad to have you.
Thank you. I'm so excited to be part of this. Thank you for inviting me.
So you are the co-founder of the Arizona Independent Pharmacy Coalition, but you also have a day job. So why don't you tell our listeners a little bit about that?
Well, yes. So I have a independent pharmacy in Sun City. It's a first retirement community in the U.S. So guess what? I take care of Medicare Part D. So DIR was my friendly. I'm so much familiar with DIR, and I had a lot of hair when I opened my pharmacy, and now I don't. So you can see what's going on. So that drove me to working on PBMs and figuring out how they can be fair and make sure that all independent pharmacies get what they deserve.
I love that. And yes, DIR has not been friendly to anyone, but especially not anyone with a very large Medicare Part D population. So again, we're so grateful that you're able to join us. So how long have you been working and advocating for PBM reform?
So let me tell you, honestly, I was really scared in a sense. When I had to first testify, I was so nervous. I spent almost 2 hours. This was probably 3-4 years ago. And I drafted exactly what I was feeling in my heart, what it was. And it was a transaction bill. I sent it to Monique and I think that Diane to say, can you please edit? It was almost like 9:30, 10 at night. Like, can you please edit to make sure, because it was my first time. And so they gave me feedback. And you know what happened when I had to testify at that time? PCMA person was before me, and the things that they said was completely wrong or untrue, I would say, and that kind of triggered too much. I felt like, and I still did my I testified it, but it hurt me quite a bit, and it triggered some things in me, like why they're saying things that are not right. And that took me to a different path in a sense. So I started looking into different ways, like, hey, what is it that triggers, or why would somebody say something that would trigger you inside? And on that journey, started looking at different ways. In a sense, it's marketing, right? For my pharmacy, how do I say certain things to my patients so that they will feel valued and they'll come to me? So there are things that you can do and say ethically that is right, and that will trigger the response. So based on that, I started researching. It's like, what is it? How does the marketing piece work? And doing that research, I found a book, and actually it's a professor from ASU. His name is Robert Cialdini, and he wrote a book, Influence. And basically, it's a psychology of persuasion. And there are 7 different things into it where we feel certain triggers. When those things are mentioned, everyone is connected in a different way. So when I start to testify, I kind of combine that into it to get that. So I have no idea which legislator will connect to which point, but in a short way, I try to connect that to see how I can, in my 2 minutes, how I can give them the tool that they feel that is important.
That is so impressive. I love that you're bringing psychology into this. My dad has been a pharmacist for 50 years, and he said the best class he ever took in pharmacy school was the 1 semester of abnormal psychology, because it helps him so much in the retail side, getting to understand why patients may have a reaction to explaining to them why something isn't in stock, or, the frustration that we get a lot as the front line in the pharmacy is not directed at us. So you have to try to figure out how to problem solve and do that. So I think bringing psychology into this makes so much sense, because then you're able to figure out how that legislator is going to connect. And hopefully, if it's a legislator, if they're championing not only pharmacy, but maybe education, then obviously you can make sure that teachers that are in your store are reaching out to that legislator, because they're going to connect with them on that personal issue.
Absolutely. And I think how we approach it makes sense. Every word has a meaning. I mean, how it impacts a certain way. And so I'm not an expert. I'm still learning. I'm a way rookie on it, but it gives me some pleasures. Like, why? I see marketers online, right? But wait, do this, do that, right? That's the whole game. And it's how it triggers us inside. We need to understand that, because we independent pharmacists don't have a lot of money, in a sense. We have a little time, 2 minutes. I have to make an impact in that 2 minutes. So we need to figure that piece out and learn it and kind of implement it to see best we can. So that's one of the tools that I use to create my when I testify.
And again, 2 minutes can seem very daunting, because there is no shortage of information that we want to let our legislators know. We want to try to tell them all of the things that we're a subject matter expert on, just to prove that this is something that really should be taken seriously. This is what our livelihoods depend on. This is what our patients depend on. So there's a lot of pressure on the pharmacy side, the owner side. You're speaking for your employees, you're speaking for your patients. So you really are trying to maximize that 2 minutes. But sometimes pharmacy owners go into it and they are trying to build them a clock instead of telling them the time. They're trying to lay the groundwork of, well, back in the 1970s, there used to be this, this is how it went. And there's some legislators that you can suddenly see their eyes start to glaze over, because they know they're never going to get it. And so, sometimes it's too in the weeds, and then you walk away from the testimony thinking, I don't know if I did very well. I tried. I spoke as fast as I could so I could get my 5,000 words in, But I think, Ken, you are very precise in what you say. And so that, I think, is what legislators really appreciate. They know that this is not an easy issue. A lot of them even know that they probably haven't done all they could in order to help pharmacies at this point, because there's still so many issues.
Correct.
So you give them the feeling of, this is a solution to the problem, and you lay that out. And that's one of the best things that you do in your testimony.
So, and I think, I cannot take the whole credit. The credit goes to AI. So here's the tool that I use. So
truth. No, just kidding.
So here's my process, right? At least for HB 2208. what I did is I copied the whole bill, put it in ChatGPT, and say, hey, as an independent retail pharmacy owner, if I have to testify for 2 minutes, can you create me a speech, right? It creates me a speech, and then I customize it to who I am and how. And once it creates that, then I say, hey, can you now analyze the psychology from Dr. Childiani and see if it meets those criterias?
Mm-hmm.
And give me suggestions based on that. And so I kind of customize it based on that. And then I practice it to make sure it's 2 minutes. And that's the key, right? It's like, that's how it has to be from my heart. AI, I'm using it as a tool, but it has to be who I am and why I'm after this. And so I kind of customize it in that sense, that it comes from me with the help of AI.
And you can use the help of AI to give you that template, just to give you
Absolutely.
that, the broad overview of what you should be hitting, but you sprinkling in those personal anecdotes and tying it back to your own store, your own customers, your own employees. That's really what the legislators are looking for.
And that's where I add the stories, right? Like the impact of, hey, our diabetic patients or patients with blood thinning medications, how that impacts or what that loss on every prescription when you extrapolate to number of prescriptions we fill. And we're in a senior town, almost that's blood thinning medication is the top drug. And so if you just extrapolate, that's a lot of money that I'm filling a prescription, but at a loss. So that's why we're like, hey, we're asking for fair, just pay us whatever acquisition cost is plus dispensing. So we're not asking for give us like crazy number of profit. We're asking just for what we are buying for. I mean, what kind of business does that you cannot get what you are paying for?
Mm-hmm.
How?
Yeah, no business.
Right.
No
Yeah.
business.
And whenever you spoke about transaction fees a couple of years ago, and you used the analogy with the ATM fees, that was something easy that legislators know about because everyone has used an ATM in the last decade.
I mean, exactly, right? I mean, every time you go and check your transaction for the bank and bank takes money. I mean, that's how what they were doing to us. And I'm sure they're still doing it some other states. And that's
unfortunately, Illinois. That's right. We haven't gotten that law passed yet. We need Ken to come to Illinois so we can get that law passed.
I'll talk to my friends there. Okay.
Oh, well, I really think that's the most important. Like you said, that not every legislator is going to connect with one approach. So making sure that you have a couple different options in your limited 2 minutes is very helpful. And I'm sure that you've also spoken to your legislator one-on-one, your own personal legislator, to make sure that they understand what's going on in your community and for your patients. And so, you use that 2 minutes to really show the other members of that committee why your legislator is supporting you. Really, that's what that testimony is.
Absolutely, yeah. And I think that chance to talk to them one-on-one first, and showing them that makes a big difference, right? And all the other like 9 or 11, whatever the committee is, you don't get a chance because they're all over the state. But in that 2 minutes, that's where you can hit them and tell them exactly what's going on. And I'm sure there are other messages that they might have received, but when you get it to that 2 minutes and coming straight, and I sometimes I've told them they can visit my pharmacy. I can show you exactly what I'm talking about, because that's coming from the heart. That is true, that what independent pharmacies are facing. And it's not just in Arizona or in Sun City, it's all over US, right? It's 20,000 plus independent pharmacies are facing that same challenge. It's just because we are not big, they are just squeezing us. And that's not fair.
Mm-hmm. Oh, absolutely. And I really think that's where this notion comes into play that we've seen in other legislative committees or whenever there's other PBM reform introduced into different committees, that pharmacy owners get kind of painted as bad business people by PCMA. They say, if we have PBM reform or any transparency, then that would mean the independent pharmacy owner wouldn't be searching as hard as they can to find the best price of the medication. I don't know any pharmacy owner out there who doesn't know to the penny what their bank account is, what their, operating expenses are. And so I really think that is so disingenuous, is the nicest way I can say what PCMA is saying, whenever they try to paint us as bad business people or complaining or whining about not being paid fairly. But pharmacists go to school for a long time to be a professional. They have a professional degree. They are providing a professional service. And so that really should be paid consummate to what you are doing, because that patient is getting the benefit of what you're doing. So
Absolutely. Yeah. And I think any field, right? Let's say if a doctor, for example, the thing that bothered me the most was the good RX, right? When now doctors' offices were having it, not knowing that, okay, I'm helping a patient. And guess what? Now Good RX has own medical programs, right? They're providing services.
Mm-hmm.
Now, if I send a patient to a doctor's office and say, hey, give that patient a $39 or $29 coupon and provide that service, none of them will do it. And rightfully so, right? But as an independent pharmacist, I have to educate the doctor, say, hey, this is wrong. When PCMA says independent owners don't know business, let me tell you, they will start seeing that, right? I would say industry standard, inventory, for example, right? Average turns usually is 12 to 14 turns. I bet you every independent owners is probably more than 20, 18 to 20. Unless they're less, then that means they're not doing something right, right? We watch every penny. To be in this business right now, every penny counts. And they are looking, independent owners will look at those kind of things. Where are we bleeding? How can we control those costs? Because we're putting band-aids all over, because we're bleeding all over. It's not
yes.
Right? So that's where independent owners know the business. And that's why they are saying that, hey, we're not being treated fair. What we want is a fair reimbursements.
And it's across the entire country. It would be one thing if this was just happening in Arizona or Texas or Illinois or some little pockets of the country, but there are stores closing across the country every day. It has nothing to do with the fact that Arizona pharmacists have figured it out and Illinois people haven't quite gotten it yet. It is the fact that these Goliath middlemen are able to manipulate the system to a point where 20,000 independent pharmacy owners are all saying the same thing. And there's so many different vendors, there's so many different products that the pharmacy owners can utilize in their system. Not every pharmacy is set up exactly the same way. So I think the fact that we are taking this big herd of cats, as you will, pharmacy owners, and manage to get them all rowing the same way towards PBM reform is because of people like you, Ken, that have stepped out and really spoken up and shown people that people for years were terrified of retaliation, or have been terrified of speaking out so they wouldn't look like they were whining or complaining or being a bad business person. But it's really about protecting your patients at this point.
Yes.
And so that's the access that your patients have has to come first in this.
Absolutely. And I think every independent owner, I was in that boat, let me tell you. I was skeptical. I was afraid. Rightfully so. When you're starting a business, you have no idea what they'll do, and technically they should not be doing it, or they should not do it, but you don't know. And there are fear of unknowns, right? And so, but I highly encourage every independent owners to kind of talk about it. If we don't mention it, if we expect somebody else to do it, then guess what? We're not doing anything. We have to do it for ourselves. And if we don't do it, then we should stop complaining, right? When I look back 5-6 years ago, hardly people knew about PBM. Now everybody knows about PBM, right? It was, I think, how do you eat an elephant? One bite at a time. And that's exactly what everybody has done. That's why now the big elephant, everybody knows about it. And I think whatever way you can. It's not that you have to go out and do everything, but whatever way you can, help. Even somebody who's doing things, support them, help them. Because now we are able to see the light. We're
Mhm.
almost there. We need to do whatever we can to go through it, right? And that's just my feeling.
And I know that there's some owners that have gotten kind of beaten down or discouraged because maybe they haven't gotten a win in their state, or maybe, they haven't seen the win at the federal level that we've all been championing. So I know that you work with different groups, different owners, to kind of have a community. So that's really the camaraderie that a lot of these owners are looking for. So is there anything you can say to an owner who might be feeling alone or so discouraged, or thinking, sometimes owners think of other owners as competition, but I think we're all past that now. So is there
Yeah,
anything you can say to support
absolutely. I would
them?
love to. I moved my pharmacy about in 2019, 1 mile from my location. Okay. So that same location, somebody else opened it. Now, typical business owners like, oh, he's my competition. Guess what? He's not my competition. I've not lost a single patient to him. And guess what? We are helping each other. Louis and I, he calls me, hey, Ken, what do I do here? Or if I'm in this, we help each other. There's a big pie, right? All we need is a little bit. Our competition is you all know who our competition is. It's not an independent, right? And as a team, if I just say that, okay, he's a competition and I'm not going to help him, guess what's happening? I'm hurting myself too, because
Mm-hmm.
he's going to go down, right? Then slowly all the independents are affected. So yes, there are that you might have some secrets you might don't want to share. It's okay. But in the larger scheme of things, we are all in together and we need to help each other out. Now, there
Mm-hmm.
might be some that might think that, hey, I'm alone. What do I do? There are so many Facebook groups for independent owners. There's so many talented independent owners that are helping each other out. So you can easily join those groups, right? Even if you have your pharmacy systems, right? Either RX30 or Pioneer or whichever pharmacy system you have, they have their own groups. You can ask them, right? Lot of little things you can learn by asking questions. I mean, simple things. If I don't know how to run a particular report, with how many prescription I'm losing money on, okay. If I don't know, I can easily ask that question into a Facebook group and somebody will help you, right? Just have a willingness to ask that question, and there will be people that will help. So there are tools. It's just we have to have the willingness to go after and see what can we get. How can we find a way? Let me tell you, I spent time on to learn. It's like, okay, that's interesting to me. It's like, okay, how can I make my pharmacy better?
Mm-hmm.
And at the same time, there are things um, that they will guide you. They'll tell you, and all you need is one idea, right? You know, one thing, it's all about the experience. Every patient that comes to our pharmacy, if we call them by their name, right, we're building that relationship.
Mm-hmm.
That's the experience for the patient. If every staff member calls our patients by their name, they're not going to get that at a chain store,
Mm-hmm.
right? That little thing. And how many times can we see their name? They're giving us a bottle, they're giving us a prescription in their hand, or even if it's electronically, right? Even at the cash register, when you ask their date of birth, you can call them by Mr. Jones or Mrs. Jones or whatever it is. Interacting that little bit can create an experience. Sending a thank you card, right? I have an employee, her job, every shift that she works, she has to send 3 thank you cards. Any patient she wants to, 3 thank you cards. But every patient, when they get that in the mail, that creates an experience.
Mm-hmm.
That's not going to be right anywhere else. And those little things we have, and that's something that I'm learning is I have a goal in my pharmacy is my patients. If I can make them like very well loved and respected and taken care of, they are going to go out and bring patients to me. I don't even have to market, right? The independent owners that you mentioned, they're filling by themselves. they just look inside their four walls and say, what can they do?
Mm-hmm. There's definitely ways that you can create your customers' ability to have a community around you and support you. Because I know there's so many owners that say when they post, a flyer about the upcoming legislation that they're trying to support, or a QR code so they can contact their legislators, there's so many different customers that seem to come out of the woodwork and say, I called my legislator, my state rep, and I said, you better support my independent pharmacy because they took care of my sick child whenever they had to come in and fill that prescription an hour after the store closed that day. So my child didn't have to wait until, the next day to start their antibiotic. Those things people remember. And so they're willing to support you. But a lot of the owners have to make sure they're asking those kind of things and creating that opportunity for the patient to support them.
Absolutely. I think we're afraid, and sometimes, like, can we ask? We're, as a pharmacist, I think we want to take care of them. Somebody was talking, I forgot who it was. If you ask like one patient, get one extra patient referral, I mean, that's you're almost going to double your business. Think about it. If you have 1,500 patients and they get you 1,500 more patients, you
doubled your business.
That's right. They say that if you have a negative experience in a location, in a retail establishment, you will tell 11 people.
Yes.
If you have a positive experience, you will tell three at the
yep.
most. So you have to do 4 times as much work on the good side to counteract one negative interaction.
Absolutely.
And so and owners know that patients are why their doors are open. So they're actively trying to make sure that those patients have access to them and taken care of. So what would you say has been the most effective either testimony, commentary, or talking point that you have given in your discussions with legislators and in your advocacy efforts?
There's so many talking points. You can see I talked quite a bit. So I tried to figure out which one would stand out. But I think connecting with the patient, like a legislator or anybody on one-on-one, where they genuinely see the impact that as independent owners, what we make and how it can impact when a pharmacy closes. I think when they see that, that's when they realize that, hey, this might be a small business like any other business, but they affect so many people in the community. And when they see that one-on-one, and when they visit a pharmacy or when you talk to them, that's when they realize the impact. And that's why I said earlier, it's like whatever you can, talk to them. Sometimes you might not even know they might be your patients, and you have no idea that they're coming to your pharmacy, and they love you, but you haven't talked to them about, or you haven't asked them about what the needs are. So just Google it, see who they are, and be. I kind of easy way of saying would be is like look out for them and say, hey, how can they know what you're doing? Because they need you too, right? It's their community. They are part of the community, and you are part of their community in a sense. So it's a teamwork. It's not just we're trying to make ourselves better and not them.
Oh, absolutely. We have legislators, when they've come into our store, they're shocked at how many different people come in and speak to the pharmacist or our staff. We know to ask about their kids or their grandkids or their family, their dog, their job, whatever it is. And so they see the relationship that we have with them. And legislators usually can only have that at one of their fundraisers, or if they go to a community event, something like that. And so that's really where they're able to get that one-on-one time. So they see the touch point that we are and the resource that we are as the pharmacy owner, pharmacy staff for their patients. And so they know that if Mrs. Smith is calling their state office about an issue with their drugs, they can call us and say, hey, can you help us so Mrs. Smith gets a solution to this problem? And so they're able to see that these are not just numbers.
I mean, every independent owner, when they started, right? I mean, they went out and they did everything possible to get the business growing. But it's what? It's a connections. It's looking at, nobody's going to walk up and say, hey, give me medication. I mean, you have to be good, right? I mean, if you need a antibiotic or something, that's understandable. But when somebody wants to you take care of their health care, they're not going to go to random people. They have to. I mean, why? That's why we are the trusted professionals, right? Number one trusted professionals is pharmacists. And when you build that relationship, the counseling that you provide, that gives them, they move the needle in a sense where they get better health outcomes, and that's why they trust, right? And so, but legislator will know when they come and see you at the pharmacy. Saying somebody just because, hey, I'm a pharmacist, yeah, okay, so what? But when they actually see it, that the impact, and then when the patients call, they know that, hey, this guy is genuinely working hard and doing everything possible to make a difference in the community. And that's what the gist of the whole independent owners are, is like, hey, we want to take care of our patients. And when we do it, we just want to be fairly compensated for it. We're not asking for crazy money. Just pay us what our cost is plus a dispensing fee. That's all we are asking for.
Absolutely. That's why legislators, I think, are starting to get the point, and a lot of them have understood that the reform efforts, the transparency efforts, really are true to what we are saying. It will save money. It will allow the independent pharmacy owner, staff to be compensated for their work, because that's really what is not happening now. And so patients are unfortunately facing that burden. And I really think that's a tipping point that people are finally getting to. And that's what it took for PBM reform to really take the place it has in our communication, our culture right now. It's enough people have finally understood that we were not joking when we were testifying in these hearings. There is real world consequences for not having any of these measures in place and enforced. And so that's really what we're looking to have happen. Just give us the level playing field. We're not asking you to automatically make independent pharmacy owners winners. We're just asking for the level playing field, and that the Goliath is not allowed to change the rules at their whim. That's all we want, because we know we are competitive enough as independent pharmacy owners that we know we will do whatever we can to take care of our patient. And
Absolutely.
So you want the right medication at the right time to the right patient for the right price. That's
right
really
way. The right way.
the right way. See, I like that. I love that. So that's really the goal of what we are trying to accomplish. We are not wanting to make all independent pharmacy owners billionaires. We're trying to make sure the patients are able to be taken care of. And the way they can do that is we can afford to replace that medication on our shelf to take care of the next patient. Because if we lose money on that first bottle of acetaminophen, we're not going to be able to replace that.
Correct. No, absolutely true, Lauren. I think that's exactly what we are fighting for, to say, hey, we'll do whatever we can. It was a slow start, but it has created a momentum, and we're getting there. So I'm quite optimistic, and any independent that are still on the sidelines, I'll say jump in, and everybody that is doing their part, thank you so much. Because of what you have done, we're able to move forward and do the things where we are. So thank you.
I love that, Ken. Thank you so much, really, for everything you're doing and for the brilliant advice you've been giving us today. I just have one last question, Lauren, if that's okay, before we close out. I'm just dying to know what was it about the book Influence? What was like one piece of advice that really stood out to you from that?
So there's 7 different things. Okay. So first one is reciprocity. Okay. Second is commitment and consistency. Third is a social proof. Fourth is authority, right? When an expert talks about it, right, there's a connection. Fifth is liking, and then sixth is a scarcity, so fear of missing out. So when independent owners are not there, or pharmacy loses, right? A pharmacy deserts, when we think about it, are growing, and so having those things intertwined that connects it, uh, and presenting in a way, in a short and sweet way, in a sense, uh, kind of connects to people in a different. I'm still, so this is influence. He also has a book called Persuasion, which is how do you persuade people to a certain way. And so it's my baby steps. I'm a process, but I'm learning. But
That's
I
great.
really love how he has, and the cool thing about this is it's ethical. It's, and he has done studies and done research in most ethical and compliance driven industries. So that is where I feel like I feel more connected, is because I know there are marketers that will go out and say things and do things which is not ethical and sell you stuff, and then I'm like, why did I buy it when I didn't even need it, right? So he's not trying to do any of that. He's genuinely trying to see why, what triggers us in taking action. So I'm trying to work on myself to figure out what do I need to do to get more action.
I
Okay,
think
so
it's so great how you were able to use that, though. I'm sure he never thought that they could use this in independent pharmacy advocacy.
correct, but it's just AI kind of. So if I had to do it, I'm not sure if I would have combined all that in a sense. I would have thought of it, but with AI, that's feasible, and then we can customize it to ourselves. So
And again, this is something that you can do on your own. There's resources at PUT, there's resources with so many of our Facebook groups. Please reach out to us. We're happy to connect you with someone who either is in your state or has a similar issue that we can help you with. So you are not alone, as Ken said. This is a way that we can work together and get as much information in front of whoever needs to hear it, legislators, your patients, whatever we can do, because our entire goal is to move PBM reform forward in 2025. So, Monique, any parting words?
Nope, just thanks, Ken. It's been wonderful. I'm glad we got the chance to have the time with you.
oh, my pleasure. Thank you so much, and wish you, all the independent owners, all the best, and let's do it.
That's right. Well, again, this has been another wonderful episode of the podcast, brought to you by Pharmacists United for Truth and Transparency. Keep fighting the good fight and bring on more PBM reform. Have a great day. Thank you for joining us for this episode of the podcast. If you don't know us, we are from Pharmacists United for Truth and Transparency, or PUT, and you can join us at truthrx.org, and you can get a multitude of different resources. You can sign up for our newsletters. You can follow us on social media. You can really get a wealth of information from all of our outlets. You can also donate to our cause at truthrx.org/donate. We appreciate your time today, and hopefully you'll join us for the next episode of the podcast.
PBMs are robbing you day in and day out, making you work for below-cost reimbursements. Billion-dollar corporations hurting hard-working independent pharmacy owners as they line their pockets and put so many of you out of business. And now it's happening with so many pharmacy software vendors that have sold out to billion-dollar hedge funds. Are you truly happy with your pharmacy software vendor? Is support what it used to be, or you find yourself waiting on hold? Are your issues resolved in a timely fashion? When is the last time you took a look at the bill from your pharmacy software vendor? Perhaps it's time for a change. Visit our website at www.datascanpharmacy.com and give us a call at 1-877-222-7979.